Welcome back to another episode of The Learning Curve. I am your host, Irtaza Asar. Today's episode is about feedback. Have you ever walked away from a shift wondering, did I actually help that resident grow? You're not alone. Residents crave feedback. Not just weeks later, not in vague generalities, but actually in the moment when it can actually shape their skills and confidence. Yet too often, feedback gets lost in the shuffle of a busy ED, or worse, delivered in a way that feels awkward, incomplete, or even harmful. On-shift feedback doesn't have to be complicated or time-consuming, but it does have to be intentional. In this episode, we're going to explore why on-shift feedback so often falls short. We're going to talk about simple frameworks to make it effective and consistent, and we're going to talk about how to tailor feedback for high acuity cases, struggling learners, and also senior residents. And plus, we're going to talk about some resources that you can use to build a culture of growth in your program. Joining me today to share his insight is an educator and feedback specialist, Dr. Brian Merritt. He is an incredible educator, and he's currently working at the University of Utah residency program as their medical education fellow. He's going to share his incredible insight on this challenging topic and help us become feedback experts. Brian, thank you so much for joining me, man.
Yeah, thanks for having me. This is awesome, and thanks to you for putting all this together and being such a great educator and uniting all of us again.
Hey,
So this is awesome.
I appreciate that, man. I'll make sure the money goes in the bank account after
Yeah.
So, Brian, one of the things that we do before every single episode is I always ask my guests, hey, what is your special skill? What is your secret superpower that nobody knows about? What's yours, man? Tell me.
So I spent a lot of time thinking about this, and compared to some of your prior guests, I don't really have any fun special skills. But a lot of them are what they presented at the teaching fellowship, and mine was actually a weird abundance of knowledge about Groundhog Day,
Oh.
the holiday in Pennsylvania about a groundhog who tells the weather. So if you ever run into me, feel free to ask about Punxsutawney Phil and some weird facts about rodents.
Dude, that is awesome. And now I know 100% you're going to get confronted at the next teaching fellowship, or you're going to get confronted at like ASAP at their next national conferences. People are going to come and talk to you about Groundhog Day. So I feel like I've really paved the way for that. So I'm excited. And I think that's actually a perfect segue into feedback. So to set the stage for this conversation, Brian, let's talk about why feedback often falls short. So can you talk to me and give me some insight on why educators struggle with this?
Yeah, so I think there's a few big components. One is just kind of a lack of structure and a lack of background from the educator perspective. And I find this in education as a whole, where we finish residency training, we finish all this training in medicine, and then we grow up and we're expected to work and teach with residents and students, but we often aren't really equipped and prepared on how to do that as successfully as we can, and feedback certainly falls along with that. So oftentimes just this lack of structure, you'll get the really good job, or keep reading, expand your differentials, all these kind of generic phrases that you hear, and it's just because we don't know what else to say a lot of the times. So that's a big component of it. Another is it's a busy department. We all want to try and get out on time. We're trying to finish notes. We're trying to clean up our board for sign out, whatever the case is. And feedback often falls short because it isn't a necessary thing we have to do as compared to some of these other things that we're doing in the department. So it either gets delayed, forgotten about, often just ends up in a new innovations eval or MedHub eval 6 months later when you're meeting with the PD. So that is one of the other big components. And then I think another one that needs to be addressed as well is the fear of giving bad feedback and the fear of having that awkward interaction with learners. And if I give a resident bad feedback, are they going to then give me bad feedback? And that looks bad on my evaluations. Does that affect my promotions? Does that affect my job? Right. And not only that, it's just, are we going to have weird interactions from now on? Is this always going to be an awkward encounter when I talk to you because we had a bad shift together and I gave you negative feedback? Especially trying to organize that in a way to address a struggling learner, I think can be really difficult. So those are kind of the main hiccups and the reasons I think feedback often falls short.
Absolutely. And as soon as you were echoing some of those things, I actually started having flashbacks of my own training. And I'm like, man, every single point that you made, I am pretty sure at some point in time I had that kind of encounter with somebody giving me feedback. So for example, getting feedback like, hey, you need to be faster. And me kind of thinking, like, but how does that really help me? Yeah, you've told me that I have an issue, I have a problem, but what do I do about that, right? So that feedback tends to fall short. So really having a strong structure, I think, makes a huge difference. And a lot of the times we as educators coming out of training, we get this sense that, okay, we know how to teach, but then there's that added layer of nuance is how do you teach somebody how to teach? And I think that's where things sometimes can fall short because we don't really get formalized training on how do you give effective feedback. And I think that's actually a really great point. And I know about that idea of, trying to avoid hurting somebody's feelings. I can remember countless times during my training up in the ICU, for example, where I would ask one of the locum doctors, hey, do you have any feedback for me? And the locum doctor was stunned. He was like, oh, why is he asking me this? And I asked him, I was like, yeah, I just want to get better. Is there anything that you would want me to do better for the next time that I'm on shift? And he turned to me and was like, this is probably the first time I'm getting asked this. And, I usually don't do it because I found that if I give somebody constructive and or slightly negative feedback, they tend to shut down on me. And that was one of his fears as an educator that he confided in me. And I told him, listen, no, I would rather just know if there's something that I'm doing wrong so that I can do better. And the only way I'll know is if you actually tell me versus me doing the wrong thing over and over and over again. And then ultimately that affecting patient care. So I think that's actually a fantastic point as well. I really liked this point that you brought about the time pressure. The emergency department's fast paced. We're juggling lots of patients. We're juggling our learners, trying to make sure that they're keeping up with everything. And then sometimes I feel that as clinicians, we get this sense that, okay, I just don't have time. I have to try to get home on time. I have to try to get my learners out on time. So me trying to spend that extra 15, 20 minutes trying to give somebody feedback might actually be detrimental. But I think that's a really big misconception that I think we can really try to address and break down throughout this episode. Have you had experiences like this in your medical training?
All the time. And so one of the things I started doing during my fellowship to try and combat this is empowering the learner to take on feedback. So what I tend to do is at the beginning of the shift, I tell them that we are going to do feedback before we go home. And that's like an expectation on all of my shifts, and all the residents know this now. But I will tell them at some point between halfway through the shift and 15 minutes before the shift is over, I want you to come find me when it's a good time for you, and we'll talk about feedback. And that way I'm not interrupting them doing notes. I'm not interrupting them trying to make consultant phone calls and things like that, but it still gets done. And then they have, an extra 10 minutes after they see a few patients, they're tidying up some dispos, they have some time, they come and find me, and we still get it done. And then we're not belaboring it, we're not delaying it, and we're doing it is the important thing.
Yep. And I think that goal posting, I think, is so helpful. That's something that I've actually adopted into my practice as well. So what I do is on a sheet of paper, I try to do 4 topics during an entire shift. Sometimes we do way more than 4 that I try to cover with a resident. And I tell the resident that I'm working with that, hey, at the end of this shift, I want you to pull me aside and we're going to go through this again, and I'm going to actually give you feedback on the entirety of the shift. So now it's almost become this ritual of sorts where residents know that I'm going to pull them aside into the comfort room at the end of the shift. So they know that regardless of whatever happens, at a certain point in my last hour of my shift, we're going to do a shift debrief for 10 to 15 minutes. And that's going to happen every single shift. So Brian, I think that's actually a really great segue into next topic that I want to pick your brain about. What are some effective strategies that we can employ to deliver better on-shift feedback?
Yeah, so timeliness is a big one. So using that method of kind of putting the onus on the residents or the learner and finding a good time for them in their busy schedule. Obviously, we're doing things as well from the attending side, but oftentimes they have more on their plate or they are seemingly busier. So I like to offer it to them. Another big thing is, especially after, critical cases, really complicated cases, or certainly bad outcomes, things like that, I think it needs to be appropriately timely. And I say that it doesn't need to be right away necessarily. Sometimes there needs to be a debrief, and you just need to walk away, let the learner have their space, and then find time after that. So if it is a successful resuscitation, maybe we do it right away. We step outside of the room, walk down the hall, have a debrief. Or if it's a bad outcome, we end up terminating a resuscitation. We have to find a delicate balance of making it timely in that it happens shortly thereafter, but not overwhelmingly so that it affects the empathy of the case, it affects the emotions, and doesn't really stick all that well.
Yeah, and I think that's a great point. I know with emergency medicine, you can get these very high stakes cases where a lot of different variables come into play, a lot of different outcomes can happen. And I found with certain high acuity cases, I like to do my debriefs shortly afterwards, letting the learner decompress for a little bit. Recently, we ended up doing a thoracotomy. After doing the thoracotomy, let's let my learners debrief, and then I'll pull them aside and I'll talk to them about, hey, what do you think went well? What do you think we could do better? And then just navigating that framework about things that we can do for improvement for the next time a situation like this arises. But I think that's a really great point, because when you have cases like this, it's better to do it in the moment as opposed to weeks to months later on, because again, then that information doesn't really stick. The memory is not still fresh. And if you have all the relevant facts, the data in front of you, you can look at it in real time and just reflect on that. And I think that really helps. What else from your standpoint can help make us better feedback experts?
The big one that I really try to drive home when I'm talking with residents about this, when I'm talking with senior residents who I'm trying to educate on how to give feedback, is goal setting at the beginning of the shift. And I think this is one of the most important pieces, in my opinion. So finding something that the resident is actively working on or something that they want to improve, and noting that throughout the shift. At the beginning of all of my shifts, we do SMART goals, which is one of the frameworks you can use just to work on your goal setting with your learners. And that allows me to, like, on the back of my sheet, I write down all their goals. So I have something specific to look out for. Obviously, you're looking out for all the other things that they're doing in the department, but that is a lot of things that they're doing, right? They're attending to patient care, they're documenting, they're making phone calls, they're making decisions, they're doing all these things that is so overwhelming to pick a couple things out of that sometimes. So equipping yourself with a few specific things to look out for, I think will improve the quality of your feedback. It will help them grow because they're actively working on something that they are getting ongoing feedback about. I think it really helps to commit to the action of doing it in and of itself. So that is one of my biggest things. And then another's adjacent to this, but focus on one or two things. It doesn't need to be everything that they're doing. Like I said, they're doing a lot of stuff on a shift. So picking a couple things. Is it your efficiency? What about your efficiency do you think that needs to be improved? Is it efficiency in disposition? Is it the way that you order your testing up front and not doing serial testing and things like that? Is it delaying phone calls? Is it all these things, right? So picking something specific out of that kind of broad goal that they have and really addressing that in specific. Another thing you can do is the start, stop, continue method, which I find helps quite a bit. So what's something that you're not doing that you could be doing that you should start? What's something that you're doing that you could potentially stop? And what's something that you're doing that you think is working well and you want to continue doing?
Awesome. And I think those are fantastic strategies that we can employ. Just to pick your brain about SMART goals, I'm actually a huge SMART goal kind of guy as well. Each faculty advisor in our residency program is assigned a particular group of residents. And every quarter we work on developing SMART goals. But I really like this idea of developing SMART goals for each shift, because I think that can also give you some more real-time opportunities to try to engage with residents and also provide better feedback. So I know in particular some of my quarterly goals with residents have been residents confiding in me that, hey, listen, I'm struggling with ultrasound guided IVs. So I tell them, okay, so a SMART goal that we can create is that I'd like you to do 20 to 30 ultrasound guided IVs until we meet again in the next quarter. So now we have something that's concrete, that's time sensitive, that we can actually measure and then reassess and reevaluate in the next upcoming weeks, and then see where we're at, see if we're addressing some of the struggles that you're having. And then if there's still struggles there, then we can work on those and build on creating more opportunities for you to help you get better. What are some SMART goals, out of curiosity, that you have employed on a shift-to-shift basis that have really helped you?
I usually try to let the learner drive their goals. I think from my perspective, a lot of it is just focusing on really narrowing it down and focusing on what they actually want to do. Because you'll get residents that come in and say, I want to be better at resuscitations, or I want to be better at procedures, or I want to be more efficient. And that's a very overwhelmingly broad when you look at the overall scope of what we're doing. And from a SMART goal perspective, right, maybe we don't have any resuscitations that shift. So is that something that we can really focus on? Or what about it is your goal? Is it that you're now a third-year resident and you want to run the room, right? You want to run these resuscitations and you want to be an effective team leader, like Vicky talked about in one of the recent episodes about resuscitation leadership, right? Is that what you're working on? Is it that you're spending too much time in the room going over the disposition at the end of the patient encounter? Is what about your flow do you find that's inefficient? And then I will work on that. And from my perspective too, I will often try to set SMART goals of myself for the learner too. And a big thing for me is just setting expectations of myself to the learner, right? Here's what I expect of you during your shift, but here's what you should be able to expect of me, right? You should be able to feel comfortable asking me any question at any point in time. You should be able to discuss all of your thought process openly. Like, this is an open communication. This is a safe space to do all this learning. That helps to share the ownership of this relationship that we have on shift and building the structure of strong education.
Awesome. One of the things that I really just took away from that right now, and I really liked how you articulated that, is this idea of resident driven SMART goals, where you're asking the residents to provide insight into what they feel like they're struggling with. And I think that's something that sometimes we might not work with a particular resident for a few months. So us coming in from that approach of saying, hey, listen, this is a goal that I have for you, I don't think is as valuable as reversing that situation and having them create goals for themselves and then trying to help them meet those goals. Inviting reflection tends to be so important, especially when it comes to giving good feedback. Quite often, I think we do like a top-down critique, which is, hey, you did this right, you did this wrong, let's work on this. But I think having residents involved in the actual process, I think can be so valuable. That's a great point that you brought up. And one of the other things that I really love that you echoed is inviting them to have that conversation and letting them know, hey, this is a safe place where we can have a conversation about your struggles, so that in the event that there is something that we need to work on together, we can do it together. And that does normalize this feedback culture where feedback becomes a part of learning, and it doesn't necessarily mean that, hey, this is a sign of failure moving forward. So I think those are some awesome points. Now, to segue the conversation, one of the things that I think educators have also had struggles with is, what do you do with senior residents? Senior residents get to that point where their medical knowledge generally tends to be fairly strong. The foundational principles are established. They know procedurally, okay, this is how I do a central line, this is how I do an LP, this is how I do a chest tube. So a lot of educators, they ask, hey, so what can I really do with my seniors to help them get better? From your experience, what have you done from a feedback standpoint?
Yeah. So one of the things that I try to do a lot this year with our seniors is putting them in different situations than where we currently work. Like most of my time is spent at a university center and where we have all the resources, but that's not going to be the case for a lot of the graduates who go out into the community, and you have often limited resources. So framing it as, if you had this patient in a critical access hospital, you had this patient in a community hospital, is this someone that you need to transfer? Is this someone that you can manage on your own? How would you do that? And how does this case look in a different scenario? And challenging them, which doesn't increase their patient burden, it doesn't really impact their shift, it just frames it a little bit differently and really challenges their critical thinking about that patient. And another thing, I feel that some of the seniors have limited goals. A lot of it is just, I want to be more comfortable on my own, right? I want to be independent. I want to be comfortable making those decisions. So one thing I will often do with those residents is challenge them with something non-clinical, challenge them with something different. So I will phrase to them, I want you to, every time someone comes up and asks you a question about one of your patients, no matter what you're doing, if it's a burden, an interruption, it doesn't matter. I want you to thank them for being involved in that patient's care, for being so concerned that they felt the need to ask you in that point in time, because I feel like that is something that we often get burdened with. It can be a cognitive hassle and just task switching and all those things that it can be frustrating. So framing their mind a little bit differently and using that as a benefit. Or every time you interact with someone, I want them to have had a better day because they interacted with you on shift. And I think framing it that way will help build some of their leadership skills, their departmental leadership skills in particular. And ultimately, that's going to improve patient care. So challenging them a little bit differently as opposed to their patient volume or their dispo time and all these other tangibles that we have, doing something a little bit differently and challenging them from more of a professional standpoint, I think is a unique way to do that.
Yeah, absolutely. And I think that's actually something that when you were saying that, I was like, that's something that I think I can really adopt as well. So I love that idea. That's actually a great avenue for trying to target some of these seniors. I've realized myself in working with a lot of the seniors that we have in our program, they become basically almost independent pretty early on. So it becomes less about micromanaging them, but more so about coaching them about different things, whether that's departmental awareness, workflow efficiency, resuscitation leadership, and even something like this I think is so valuable. So I think the feedback then tends to be geared towards those areas as opposed to actually micromanaging them on specific aspects of patient care, which again, that's not to say that there's not any room for that, because again, seniors are still learning. They're going to continue learning. They're going to continue making mistakes. So there's always going to be opportunities for that. But what you find towards the latter half of the year as they're getting ready to moonlight and or graduate, you basically need to create some of these opportunities yourself, put them in these almost mental mind games to try to help them grow. And I think that's actually a great one right there. Brian, let me pick your brain about a different set of learners. What about struggling learners? What can we do for them and how can we give them better feedback?
Yeah. So I think with the struggling learners, it's often difficult. Like we talked about earlier, the awkward interaction, the fear of any repercussions and things like that. So I think In this situation, it's really important to be specific and be objective and having specific interactions or, specific cases. Here was this patient that I think you managed incorrectly, and here's why I think that is. But the most important thing I think with these learners is having something actionable to give them, right? I'm sure we've all had negative feedback where you just get your presentations are disorganized and then they leave it at that, or your clinical decision making was not good today, and you don't know what to do with that information. So having something to give them to facilitate their growth, to close that gap, I think is one of the most important pieces of this whole discussion. And whether that is resources, here's this article, or here is this set of resources, right? There's so many foam resources, right? Here's MRAP, here's Corpendium, here's all these different things that we can use. And I will give you specific examples. So look at this chapter of this book, or look at this article, and having a plan to follow up and what that looks like. So I'll reach out to you in a week. Even if we don't work together, I'll reach out to you in a week and see how you are doing, see if you've gotten through that material, and we can talk about your thought process and how that has changed. Sometimes another benefit would be to send a follow-up email with all the stuff in it. So it's not so much to swallow all at once, but here's this follow-up email. Here's some of the things we talked about that I think you can improve on, and here's some of the resources that we talked about. And then they have the links, they have all the resources available that they can always go back to, and being really objective in that mindset. And then ultimately, if this were to continue with a particular struggling learner, documentation and kind of managing that aspect is going to be important too, from an action plan and potential remediation if that were to continue. Separate discussion, but something to be wary of as well if it's a pattern that you notice.
Yeah, absolutely. I think that's really one of the big key takeaways that I have as well from just the things that you were articulating just now is really, I think it boils down to creating actionable things that you can really work on. I know more recently I had a young resident that was struggling with central lines, and I was fortunate enough to work with them 3 times over the course of 2 weeks, and the pattern just kept happening where their needle tip, they weren't able to visualize it that well, and it just kept happening again and again. After the second time I told them, I was like, hey, listen, here's what I'm going to do for you. I'm going to create a set of YouTube videos that I want you to watch. And then what I also want you to do is go work on the mannequin in our sim lab room, and let's work on finding your needle tip better. I'm also going to involve our ultrasound director as well, have him participate as well, so that we can kind of navigate and work on trying to help you visualize your needle tip, because that's really a valuable skill. So I tried to make it as actionable as possible, but I think that's a really great point that you've brought up. You were also starting to talk a little bit about some other resources that are out there, but from a feedback standpoint, are there any resources that you would recommend that you've utilized that have been very helpful?
There's quite a few throughout medical education, but some of the bigger ones are ACGME website has a toolkit that they use that have different presentations and education information on how to deliver feedback. There's an Amy guide, and there's multiple different books about different feedback. I would encourage you to do some homework on your end, on the listener's end, and find different models that work for you and for your workflow, for your learners and your department. Some of that might differ depending on how many learners there are, how directly you work with each of the learners. So there isn't a right or a wrong way, which is kind of the beauty of this, but also one of the detriments is that there isn't one specific answer, right? Doing your homework, finding resources that work for you and what works from your education perspective, I think is going to be really helpful. There's a couple different other frameworks. Pendleton's rules is a good one that is this back and forth between the facilitator and the learner about ideas and concepts that the learner feels that went well and didn't go well, and then the educator has their thoughts on what went well and didn't well, and then there's a summary. There's BOOST, which is another acronym that's kind of a framework. The one historic one that I think we're all familiar with is the feedback sandwich. I don't know how you feel about the feedback sandwich, but I'm not a huge fan.
No.
I find that it's always, it tends to be forced because you're trying to fit this perfect sandwich. Oftentimes it doesn't need to be that way. Highlighting the positive and or negative feedback, but it's always so unnatural to me when I try to do the feedback sandwich, because you give this negative feedback and then you say something that's not relevant at all to the negative feedback, and you say, but your ultrasound skills were good today, and it's not relevant at all to what we were just talking about. So I'm not a big fan. I was never a big fan as a learner either, getting that feedback sandwich. So I would try some of these other modalities and frameworks and see kind of what works for you.
Yep. Definitely, I agree. There's great frameworks out there. The feedback sandwich is not something that I'm a huge fan of as well. I've just found from experience, just personal experience as a learner, but also as an educator, if you're delivering it to a learner, they're almost just waiting for the negative feedback and they just tend to gravitate towards that. So everything that you say after that is like just one ear out the other and it's just gone. That was my experience as well, where somebody would be giving me feedback and the framework was the feedback sandwich. So I would hear the good, whatever, let's move on. Okay, tell me what I didn't do well. And then you would just kind of fixate on that, even though it potentially might not be that significant. And then everything afterwards was just a blur. So I felt like that really wasn't that constructive. And it almost gravitates the learner towards focusing on the negative as opposed to the overall feedback that you're trying to give them. I really like the Pendleton rules. I think those are fantastic. I've had all my discussions through that framework, and I think it's so valuable because it echoes to trying to bring in our learners and having them share their insights. So starting them off with, hey, what do you think went really well? Okay, here's what I think went really well. What do you think didn't go well? Tell me about that. And now I'll tell you what I think didn't go well. All right, so now that we've established that entire premise, let's talk about what we can do better for the next time and let's create something actionable. And I think that framework has been so valuable for me, whether it comes to specific topics in medical education or specifically even related to things like professionalism and procedural competency. I think that framework has been extremely valuable for me, but I really like your point about no one framework is going to fit everybody because everybody's working in different environments, different learners, different teaching styles. So the key is really to find something that works for you and continue to try to improve it. That's really fantastic. Now, Brian, as we're getting ready to close, one of the questions that I ask every single educator that I have on is, hey, if I'm a first-time listener, what are the 3 key big takeaways that I can take away from this episode?
Yeah. So first one is going to be goal setting, and set goals and expectations with your learners at the beginning of each shift. They might have these more longitudinal goals that they're working on, and that's great. But what can we work on this shift that I can specifically watch for and give you feedback on at the end of the shift? Number 2 is make your feedback actionable. It's going to be easier to process from the learner, and it makes it feel like it's more of a discussion and not just a true feedback session, right? I'm invested in your learning. Here are some ways that I think that you can improve these things to make you a really great resident and ultimately a really great physician. And then the other one that I always like to do is ask the resident to really reflect on how their shift went, because I think they can get all the feedback from us, but I think it's important that they recognize how they're doing as well and not just have someone else tell them that they're doing a good job or not, but spending the time of how am I doing? How did I do today? How am I doing today compared to 6 months ago? How am I doing today compared to last year? And I think it helps them notice the big jumps that they make in residency over this period of time, and really helps to not only boost confidence, but reinforce the learning that they have done and the good things that they have been doing through all their training.
I love that. And I think that longitudinal approach is so valuable. You can even do like a 180 for that as well and just ask the learner, hey, what am I doing that's not working for you? Let me know. Because if we're taking the time for me to give you feedback, give me feedback as well. How did I do for you as an intern? How am I doing for you as a second year? And now as a senior, what can I be doing better to help you get ready for attending life? So I think that's awesome. And those are some great points. So Brian, do you have any last minute final thoughts on anything else that we didn't cover today regarding feedback?
No, I think just an overall kind of picture of this is I like to think of it, and you mentioned it earlier, more of like a coach and more of a mentor than it is a pure overseer of everything that happens in the department. And I think that really helps to build this collaboration and helps to build this discussion of feedback and closing all these knowledge gaps and finding things to teach about. And I really think putting it in that perspective of we're more or less colleagues, we're going to be working together in a couple of years at the minimum. And so I'm here to help facilitate you and to coach you through this transition that you're going through, and framing it that way, I think really helps the learners kind of get on board of feedback and goal setting.
Awesome. And I think that's a really great point. I think this has been a fantastic episode, man. The insight that you've offered us is going to help a lot of educators out there just become better at feedback, because this is, again, I feel like a topic of blindside almost, where educators struggle with because they don't really get any formalized education on this. So I think there's a lot of great insight here, and I'm really happy that you were able to share all your insight with us. So in the last few minutes, is there any social media where folks can follow you, reach out to you, ask you about any insight on feedback and get your thoughts?
Yeah, I'm not real big on social media. Our residency program has an Instagram page and a website, and our fellowship page has a website as well. So I'm more than happy to take any emails and questions and things from that regard, but not big on the social media.
Sounds good. What I'll do is I'll link the Instagram page for the residency program on the show notes. So if anybody's interested in reaching out, connecting with you, they could definitely do that. So awesome. Thank you so much for your time, man. This has been a fantastic episode. And really, I think for me, one of the biggest key takeaways is you don't really have to be a master at this, but the more consistent you are, the better you're going to be. And I think little steps can really make a huge difference. So for the folks that are out there that are listening, the question that I would leave you with is, what have you done to try to give better feedback to your learners? What kind of models and frameworks are you guys using? Let us know so we can keep this conversation going. If you enjoyed this episode, hit follow, leave us a quick review, or share it with someone who'd love it. So until next time, keep showing up, keep teaching, and keep making those on-shift moments count. Thank you so much.